Hi everybody, welcome to our webcast about the terminology of hygiene relevant measures. My name is Patricia Potums and I'm a trainer at the Sales and Service Academy. Please consider that the following information is the current status of July 2020. All following information and findings are constantly being updated by experts as global research in these fields is ongoing and continuing. Kindly make sure to constantly check for updates, especially if it comes to regulations in your country. All information given is collected and based on expertise and research provided by various company departments. If you have any questions or concerns, please contact your sales support. Let's start with some general information. What is important to know? What do we have to remember? Every surface that is contaminated, where we use some procedures to remove germs, well, within a few hours, sometimes even sooner, that same surface will be contaminated again. That idea is not nice, but unfortunately reality. The extent of hygiene measures to be performed are determined by the probability of direct contact, the possible contamination with pathogens, and the condition of patient's immune system. I'm going to give you some different definitions about cleaning, sanitizing, disinfection, and sterilization. What is cleaning describing? Some different definitions. First of all, it is the removal of unwanted substances on surfaces. The unwanted substances can be either loose or adhering dirt, and the result of cleaning procedures result in a reduction of microorganisms on the treated surfaces. One single process can lead to a reduction of approximately 50 to 80% of microorganisms. What is now sanitizing describing? Sanitation is reduction in the number of germs through preventive and disinfectant cleaning measures, used to reduce germs to safe levels in public areas according to public health requirements. Compared to disinfection and sterilization, no defined or complete germ reduction is required as a result of sanitation. Sanitation is similar to routine disinfection, also called current disinfection, or, another difficult word, prophylactic disinfection. What does disinfection mean? Here we are going to kill, inactivate all pathogenic germs. There is no risk of infection anymore through the disinfected surface. It is a reduction of 99.99% of the viruses. And if we talk about bacteria, 99.999%. It is designed to kill actively growing and vegetative microbial microorganisms to a certain level. Disinfection is similar to targeted disinfection. If we have a look at different properties of disinfecting agents and we take a look to the bottles, we see some difficult words like bactericidal. Here we know that they are effective against all bacteria. We also see words like limited virucidal plus. Then you know that they are effective against all enveloped and non-enveloped viruses. What should be disinfected? According to the RKI recommendation, and that is the Robert Koch Institute, even the patient area of a hospital disinfection only on areas with frequent skin and hand contact. That means every touch point. And touch points are light switches, door handles, bedside tables, all other surfaces such as floors, ceilings, walls, lamps, they don't need to be disinfected. Cleaning is sufficient here. Floors in hospitals where COVID-19 patients reside, the so-called targeted floors, they must be disinfected. What is sterilizing? Here we're going to kill, inactivate all bacteria, fungi, viruses, and sprouts. It is used to render product-free of all forms of viable microorganisms. It is a total destruction of microorganisms under controlled industrial laboratory of hospital conditions. Heat, chemicals, and irradiation are the most commonly used sterilizing agents. Let me give you an overview of all these terms. What is cleaning doing? It is removing soil from the surface. Cleaning removes germs, it doesn't kill them. What is sanitizing doing? It is lowering the number of germs on surfaces to a level considered safe by public health organizations. Disinfecting. Disinfecting is killing infectious fungi, bacteria, viruses on hard surfaces. Sterilizing. Here we destroy, eliminate all forms of microbial life, including fungi, viruses, bacteria, and spores. And here as a company, we cannot help you. But when are we going to clean, sanitize, or disinfect? If you have areas without any risk of infection, it is very simple. You're going to clean. If you have areas with possible risk of infection, surfaces with regular hand-skin contact, the so-called touch points, you're going to disinfect. The floors, you're simply going to clean. All other surfaces, also cleaning. Areas with specific risk of infection, the touch points, you need to disinfect. The floors, here a specialist is going to make a risk assessment and he's going to decide if you're going to have a sanitation or a disinfection will be needed. All other surfaces will be cleaned. And then you have the areas with patients contaminated with pathogen that may be spread. Surfaces with regular hand-skin contact are so-called touch points. Here also disinfection is of course needed. Our floors, disinfection is needed. And all other surfaces, only cleaning. Let's talk about the differentiation of terms. What is also very important to remember, disinfectants have no cleaning effect. You can only disinfect on a clean surface. So that means that the surface must be cleaned before and must be free of all dirt. If your surface is not clean, a disinfectant doesn't guarantee a good disinfection effect. There is also a difference between a disinfectant cleaner and a disinfectant. Almost the same words, but the meaning is absolutely not the same. A disinfectant cleaner is a two-in-one product. It cleans and disinfects in one process. It is used for daily cleaning. Your surface should be free of coarse, strong adhering soilings. If cleaning and disinfection are carried out as a one-step process, this is qualified as a disinfection cleaning, and it is absolutely not the same as a disinfection. But how are we now going to disinfect properly? What are the 4 things to consider when we disinfect. As I already said before, we clean before. Your concentration must be correct. An exact calculation is very important, since even small deviations have a significant impact on a successful disinfection. The surface to be disinfected must be completely wetted. Spraying is not enough. Adhere to the exposure time. Let your surface dry, don't rub, and the disinfection is best carried out at temperatures between 20 and 25 degrees. What is now the correct procedure for disinfection? Let's take an example in the food sector. As I already said, first clean your surface completely. Then let it dry completely. Wet the surface completely with a disinfectant-soaked clean cloth. Note the exposure time. And then in the food sector, rinsing with drinking water must be carried out. In principle, disinfecting should only be carried out by properly trained persons. For more information about other coronavirus-relevant cleaning topics, please follow other webcasts in the series. If you have any questions or concerns, please contact your sales support. And please also have a look to our further episodes in the coronavirus webcast series. Thank you for being with us.
Cassia makes a difference.